by beginning at the lips, you get the fulcrum from whence you will support everything from the lower face and the upper face. Because as you pull the lips out in a three-dimensional manner, it's going to make the line or the nasolabial fold flatter, and it's also going to tell you where you have to build the buttress of support up to. Again, I don't like to use nerve blocks because as slowly as I go, people don't complain of pain. And what's most important is you want to go slowly, because if you use a block, it gives you a license to forcibly inject the material. What's most important is not creating a lip that looks artificial. So you have to know what you want to do is make the ends of the lips sort of tapered into the center lip that comes down in a pouch, and then you want to do the same thing of the upper lip. You just want to restore the volume to lips that existed at one time with slight degree of enhancement. So the first most important visual site we see in the lower face, again, when we look at a person, as I stated before, are her lips. So this is where I begin, first using Cosmoderm to do the lower and upper lip and lifting up the corner of the mouth from the inside of the mouth, then going over that with Cosmoplast, and finally using Restylane to go finally into lip augmentation. So we're building flying buttresses, which are actually building up from the jaw, going medially inside to support the lower third of the face and put the lips back where they belong. Because the distances should be approximately 28 to 30 millimeters from the distance of the lower lip to the chin, and the distance from the upper lip to the nose, the base of the nose, should be about 18 to 20 millimeters. And again, these distances get longer as we age, the mouth sort of falls, and you want to restore the volume which is lost as the face age. So this is the most important thing, is to restore what is lost with worn dental surfaces and loss of bone, and restoring the volume loss to the lower third of the face, and also reestablishing her jawline. Because once you do that, she'll have a straight jawline that won't dent in, and she'll have a continuous look to her face. By doing the lips first, you're going to need less material in this site. Now again here, I'm always going to inject sort of medial to the nasolabial fold, because what you don't want to do is contribute to it. Now in the pivotal controlled studies, the people that got the longest lasting results were people who used the serial puncture technique. I would first use Cosmoplast, which give me an aesthetic because of the lidocaine in it, injecting it medially to the nasolabial fold. I'll then put in Restylane, which is a longer lasting filler. And finally, I may inject a few spaces, just a taper feather into it with the Cosmoderm afterwards, again with a 32 gauge needle. A lot of people will inject a lot and then massage. My problem with them is massage is that you don't know if you're not massaging the stuff away. So I never really do much in the way of massage. I have patients apply ice for 10 to 20 minutes. What you don't want to do is force material away. Now, once we've done the nasolabial folds, the lips, and the build our flying buttresses, frequently in individuals they have a depression of their chin. Now, specifically, this patient had it because of an auto accident and also because she was a grinder. So what you want to do is connect the flying buttress on the right side of the face to the flying buttress on the left side of the face. When I connect the flying buttress from the right side to the left side, it really gives me a chance to do many things. First of all, I have the patient slightly open their mouth, but I have many reasons to do this. Because in looking inside the mouth, I can see whether the right and left lips are sort of equal in height and length. Also, I see the lip comes down and protrudes nicely in the center. But what I want to do very carefully now is return the volume to the area below her lower lip, connecting the flying buttress I built on the right side to the one on the left side. All along with all this correction last, it should come for a little touch of about 4 months. But the second time I do her, she'll be able to go 6 to 9 months. So that's why the hyaluronic acids have been such a great improvement in longevity of injectable fillers. The most important thing about Botox is to improve, not to immobilize. And the most important thing is to be very correct on where you put the material. I employ the EMG machine because I like to hear the muscles. It is a toxin, of course, but it's a purified protein in very low doses that we use to relax muscles. We're going to get rid of the crow's feet with this by injecting the orbicularis oculi muscle And this little machine will enable me actually to hear the muscle move. Now, with this, I'm using a 30 gauge metal hub needle because I didn't like the 27 gauge needles they use. Now, the thing about these 30 gauge metal needles is you're going to hear the muscle all along the needle, but you just want to go in with the needle until you begin to hear the muscle. And you want to put the material very superficially, the Botox, around the eye. Why? Because if you try to inject it deep, you're going to bruise the patient. The other thing is that people have many, many vessels in the orbital rim, so you have to use your magnifier and look very carefully for any vessels so that you don't create a bruise. Thank you for coming to my video, because all my life what I've really wanted to do is make this video to teach people how to inject substances or soft tissue augmentation. And I think it's really important what I've done, because I'm tempted to bring you more important than every article I've written, and more important than the books, is actually the ability for you to observe my techniques. I keep learning every day, learning about substances, so I want you to really keep abreast of the literature, keep abreast of all the new agents they're injecting, and also never be the first to use anything. I believe very firmly that you're only as good as the last patient you inject. Make sure you take your time. Make sure you use magnification and proper lighting, and make sure that you do the best every day of your life.